80 beats per minute, nag-capture yung ating pacemaker. So, nag-capture yung ating pacemaker. Okay. Next. Okay. Okay, so after giving your transcutaneous pacing, you can now give your dopamine. So dopamine is given at 2 to 10 microgram per kilogram per minute. So you need to consider the weight of the patient, okay, in kilograms here, because dopamine is given at 2 to 10 microgram per kilogram per minute. So what does dopamine do? Dopamine is an inotrope. It's an inotrope. It actually increases contractility to the heart of the patient, increases contractility to the heart of the patient. So that depends on the reaction of the patient. Okay, how would the patient respond to the dopamine being given? So an increment or decrement is actually being observed, depends on the patient's reaction. Increment or decrement of the dopamine depends on the patient's reaction. Then after which, you can now give your last letter, letter E, epinephrine, 2 to 10 microgram per minute. If you're going to notice, we will not consider the weight of the patient here. Epinephrine is given at 2 to 10 microgram per minute. Here in the Philippines, we always begin your epinephrine at 4 microgram per minute, and you're going to actually dilute this epinephrine in your D5 water of solution. D5 water of solution. Okay, so after which, be reminded, okay, ang binibigay natin na medication, hindi yan sabay-sabay binibigay sa pasyente. Every, okay, 2 minutes, okay, after giving the medication, wait for 2 minutes. You have to wait for the heart to actually respond on the medication or the intervention that was given to it. So wait for a minute or two. Wait for a minute or two. So wait for 2 minutes before you actually check again the ECG if that is an indication ng ECG natin as indicated siya kung magbibigay tayo ng gamot or hindi. So depends sa ECG. Okay. The last algorithm that we're going to discuss will be your immediate post-cardiac arrest care algorithm. So, trying to actually check the algorithms at the back. May makikita kayo dyan, immediate post-cardiac care algorithm. So, in your post-immediate cardiac arrest algorithm, so pag sinabi nating post-cardiac arrest algorithm, that means the patient already has what? Return of spontaneous circulation. Now, how would we know if there is already a return of spontaneous circulation? The patient already has a pulse. The patient already has a pulse. So, ibig sabihin yan, we will have to check the ECG again and then check if there is a pulse. So, again, ganun pa din, answerable by yes or no. If it's a yes, okay, check again what is the pulse rate. So, kung papansinin mo, pag chinek natin ng pulse rate, okay, kapag more than 150, tachy yun. Pag less than 50, brady yun. Pero, what if within the range? Okay, ito yung gagamitin natin na algorithm. Kasi ang post-immediate cardiac arrest, post-immediate care, immediate post-cardiac arrest care, ang heart rate should be 50 to 115 within that range. Okay? Pag no, syempre, cardiac arrest algorithm. Okay. So, ganun pa din, airway, breathing, circulation. Check the airway. Is the airway pattern? Check for breathing. Is the patient breathing? Check for circulation. Ano yung chinecheck sa circulation nga ulit? Chinecheck natin doon BP and O2 SAT. But in this particular case, dito ulit magkakaroon ng discrepancy. Why? Pag ang BP natin is stable, parang bradycardia, you're just going to monitor and observe. Okay? Pag stable, you're just going to monitor and observe, parang bradycardia. But if the patient is unstable, dito ngayon papasok yung tinatawag nating fluid challenge and yung vasopression. So, mapapansin ninyo, if you're working in the hospital, nagpaparun sila ng, okay, crystalloids or your plain NSS or plain LRS. Nagpapa-fast drip sila ng fluids. Okay. Napansin nyo, sa tachy and brady, wala tayong minention about, okay, increasing the blood pressure via fluids. Dito lang siya papasok sa immediate post-cardiac arrest care. Doon lang natin binibigay yung fluids natin. But in giving fluids to your patient, you can only run 100 to 200. Ganun lang, na cc of plain NSS. Okay? To your patient. Okay? But before you give your fluids, you have to auscultate the lungs of the patient first. Why? Because if you hear crackles, that means the patient is already congested. So, hindi mo na pwedeng gawin yung fluid challenge mo. You need to inform now your physician that the patient might be developing what? Congestion. So, double check mo sa kanya yung narinig mo. Double check mo before you can actually say na ang pasyente mo is congested. So, kung hindi pwedeng gamitin yung tinatawag nating fluid challenge or your plain NSS or plain LRS, you can now move forward to yung tinatawag nating vasopressor infusion. For you to remember this easily, para mas matandaan nyo siya, please remember the acronym DEN. D-E-N. D-E-N. DEN. D for dopamine, E for epinephrine, and N for norepinephrine. Dopamine, epinephrine, and norepinephrine. For the dopamine, ang dosage natin dyan is the same, 2 to 10 microgram per kilogram per minute. But, okay, tataasan natin yung dosage natin. It will be about 10 to 20 microgram per kilogram per minute. Kasi ang gusto natin would be a pressor dosage. A pressor dosage or a high dosage of dopamine. A high dosage of dopamine. 10 to 20 microgram per kilogram per minute para makakuha tayo ng pressor dose. Under your epi and norepinephrine, ang dosage natin dyan is 0.5 to 1. 0.51. Okay, milligram per kilogram per minute. Okay. Next. Okay. Ano ngayon ang i-check natin? Okay? We're going to check the reversible causes. Now, upon checking the reversible causes, yun yung tinatawag nating 6H and 60s. 6H and 60s. Now, what are your 6H and 60s? You have here hypovolemia, hypoxia, hypothermia, hypo and hyperkalemia. You have your hydrogen ion acidosis, your hypoglycemia. Next, you have your tamponade, cardiac tamponade, your tension pneumothorax, you have your thrombosis on your lungs or on your heart, and then you have your tablets or toxins or drug overdose, and then you have your trauma. So again, that's what? Hypovolemia, hypoxia, hypothermia, hyperkalemia, hydrogen ion acidosis, hypoglycemia, cardiac tamponade, tension pneumothorax, thrombosis, either on the heart and the lungs, and then you have your tablets or your toxins, and then your trauma. Now, treatment natin sa ating hypovolemia would be fluids. The treatment for hypovolemia would be giving IV fluids. What kind of IV fluids? Your crystalloids. Ganun pa din, plain NSS or plain LRS. Okay. Next, treatment natin for hypoxia, of course, your oxygen. Oxygen therapy. Okay. Treatment natin for your hypothermia is your IV warmers. So, magbibigay tayo ng warm IV fluid sa pasyente natin. Okay, if you're going to notice here, there are certain devices that we can use in order for us to warm our IV. So, kadalasan ito ginagamit sa mga blood transfusion. Pero we can also warm our IV. Okay? Or, kung wala namang IV warmer, ang ginagawa natin is yung what? Ang ginagamit natin is yung kukumutan natin yung patient natin. Okay, next. Treatment for hypokalemia. Treatment for hypokalemia, of course, we need to actually place the patient on a potassium chloride na drip. Okay, naka-volumetric chamber din siya. Be mindful, hindi pinupush or given IV bottles ang potassium chloride. Next, we can give sodium bicarbonate if the patient has acidosis. If the patient has acidosis, you can give sodium bicarbonate. Now, if you remember, meron tayong hypoxia kanina, di ba? If the patient has respiratory acidosis na meron siya